Hey guys, I just want to give y'all an update of our Joint Commission re-site survey from yesterday. As you know, we had some conditional findings on our triannual, and Joint Commission did have to come back and reassess those, and we've all been very hard at work trying to fix things, and y'all have done a wonderful job, and we were able to get most of them, all but one actually, dismissed. But unfortunately that one falls on nursing, and that one is administering the appropriate pain medication per the patient's pain rating on the pain scale. So what does that mean? That means I'm your patient, you come in, you say, hi, how bad are you hurting? I tell you, oh, I'm at a 9. So you would have to go into your MAR and see what is ordered for a pain rating of a 9. One caveat to that is you can give me a pain medication that is for a lesser pain rating with a note of patient preference. So say I tell you, you know what, I'd rather have the Tylenol, the morphine made me sick or whatever. You can give me that pain medication for the lesser rating by my preference. All you have to do is document it in the administration note so that we can see why you did it like that. If I say my pain is a 5 and I want the morphine, and the morphine's ordered from 7 to 10, you cannot give me morphine for that pain rating. It is out of your scope of practice to administer me the morphine when my pain rating is not high enough that the doctor has specified in his order. Okay, so to recap that, you can give pain medication for a lesser rating than what the patient is stating their pain is, with a note, but you cannot give a higher pain medication than what the patient is saying that their pain is. Okay. One other thing we're seeing is Tylenol ordered for a fever. We all know Tylenol is good for a fever. If the PRN does not specify that in the parameter that it can be given for a fever, you cannot give the Tylenol for a fever. So let's say I'm your patient, my temperature is 102. You go in, you see I've got Tylenol ordered for pain rating of 1 to 3. I know y'all have good hearts and you want the best and that's what's right, but you cannot give that without getting an order from the doctor. So call the provider, get a PRN Tylenol order additionally for Tylenol that is for a fever in addition to that for the pain medication or the pain for a pain. So just summarize, it has to match the PRN reason for the medication. So let's just look at a MAR, and I'm going to try to show y'all the best I can. So, okay, so we have here, okay, so we have Norco ordered every 8 hours for moderate pain, 4 to 6, or morphine ordered 4 to 6, or severe pain of 7 to 10. So this means I can give morphine if my patient's pain is between a 4 to a 10. If my patient wants some Norco and their pain's out of 7, I can do that with a note saying that the patient requested that, okay? Another thing is we are going to be escalating the discipline a lot quicker, and particularly with pain, because it was a conditional finding that they found again. Crystal and I will be auditing 5 charts a day, and we'll be coaching y'all, educating y'all in real time, so that it doesn't happen again. And it will be structured just like call-ins, just like tardies, and those kinds of things. So this is going to look very familiar, this chart. So let's say I talked to Nurse Susie today about pain. She didn't reassess her pain last night. So I call her, I tell her, hey, you didn't reassess your pain last night. I send her an email. The email will have a screenshot very similar to this. So she'll understand what I'm saying. She just won't get like, hey, you didn't do this. So then when she gets this, if I find in 2 weeks that she does it again or gives the wrong pain medication, it goes to a coaching and then a verbal and then a written and so on. So why so aggressive with the discipline? Just to give y'all some next steps for Joint Commission. So Joint Commission will be coming back in 30 days. They will be looking at our pain charts, and if we are still not where we need to be per the Joint Commission, they will turn us to CMS. So that's going to be your Medicare and your Medicaid patients. CMS can choose to not fund us, and we would lose those patients. So we would lose our reimbursement for those patients, and they wouldn't come to us. So it's very serious, y'all. We need to make sure that we're doing everything we can to A, do what's best for the patient, and B, pass this so we can move on and do the awesome care that we love to give every day. If y'all are having issues, if you have any questions, any struggles getting the correct orders for the pain, please come see me. I don't know unless y'all tell me, and I really want to help y'all, and I really, really, really want us to knock it out of the park in 30 days when they come back. And I know y'all are super smart. You work hard, you put your mind to things, you do better, and I know y'all can do this. So please let me know. I'm here for you. Crystal's here for you. Any questions you have, feel free to call or stop by. Thanks, y'all. Have a great weekend.